I would like to welcome you to this afternoon session. We will open this long session, which includes breakout rooms afterwards, with setting the scene. And for that, we have a great panel here that is already ready to face your questions and to dive deeper into the question. But we also have a lovely keynote speaker. In this session, we will talk about going digital to improve the health of young people. So we want to explore how digital health can help transforming healthcare. And for our keynote speech, I would like to introduce to you Ryan Dos Santos, who is a technical officer for digital health at WHO Europe, and he will introduce us to the topic. So Ryan, the stage is yours.
Thank you so much, and it's good to be here. It's good to be here addressing youth. I know we've started to engage and we've realized the importance of youth in health, in healthcare, in transformation of healthcare, and likewise in digital transformation of healthcare. You guys are the current innovators, the current upcoming crop, and you will be inheriting what we have started to put in place, what we've been doing, bringing all your fresh, new, vibrant, innovative ideas to the table. Okay, great. So the way the session is working, going digital, we're doing this first presentation, which I will be giving an overview of everything. What is digital health? Going into the regional digital health action plan for the WHO European region. That showcases what WHO for the European region, what we're planning to do for digital health development. And then we're going into the key areas that we're looking at, refugee and migrant health, mental health, sexual and reproductive health and rights, and disability. And these are, as mentioned before, will be leading into the breakout sessions where you'll be doing more deep dives and in-depth discussions. And we want your input. We want your input to help to shape the way that we move forward in digital health development and digital transformation of healthcare. And I have my panelists here who will introduce shortly after my presentation. And your job is to engage them. So, one second. What is digital health? So what do you all think of when you hear the term digital health? This is something that we have found that sometimes can be a little nebulous. When people hear the term digital health, they're not sure what it is. And some people may think computers, and we put a computer in a place, and we put an electronic medical record in place, and that's digital health. But it's a little bit more than that. So digital health, according to the WHO, is the field of knowledge and practice associated with the development and use. With the development and use of digital technologies to improve health. And the digital health also expands on the concept of e-health to include digital consumers with a wider range of smart devices and connected equipment, and also encompasses other use of digital technologies such as Internet of Things, connected devices in your home. We have smart watches in our hands, artificial intelligence, big data, and even down to robotics. So what does it all mean? What does it mean for us? And what does it mean for you as youth? And in a nutshell, digital health is basically using digital technology to empower healthcare in all the different areas that it is, and to use all the available digital technology to improve healthcare and to ensure that it's part and parcel of healthcare. What has happened traditionally over the years, digital health has been thought of as an add-on to health. The idea that we want is not that digital health is an add-on and we'll put digital technologies in. We want digital health to become part and parcel of healthcare. Just as vaccines and all the other different facets of healthcare, it's part. When you hear these things, you know this is health. But when you hear about health records and when you hear about connected devices, and all of these things, it's part of health. And moreover, we want the policymakers to understand that, you know what, it's just not a matter of me going and buying software and going and buying computers and putting them in place. It must become an integral part of the planning and the long-term sustainability of healthcare. Why? We all know why. COVID-19 has shown us that we have needed digital technologies, and we've seen the improvements the digital technologies have brought to healthcare. And we need to capitalize on that. That momentum that we've started, we need to continue to capitalize on that. So, how we want to ensure that youths, we want to know that you are part and parcel of that. You're part of the stakeholder groups in that. And we want you to start to think about the impacts on you. Putting digital technology in place, how will it impact me as a youth? How can I have an impact on digitalization? How can I take a role and a lead in the development of digitalization? One prime example being, for example, becoming a leader and becoming a part of health informatics, which is something of what I do, and that's bridging the gap between the medical and public health field and the technical digital field. So these are just things that I want you as youth to start thinking about. So, getting into the Regional Digital Health Action Plan for the WHO European region, 2023-2030. And this was recently launched at our regional committee, and it was also adopted as a resolution by the 53 member states. Now, the WHO European region is not just Euro and the EC, the European Commission and the European Union, but it's actually 53 member states. So we have quite a wide breadth. And all of these member states adopted this Digital Health Action Plan because they've realized the importance of digital health. And what is it about? It's to promote digital health systems to improve health at a scale within the entire region, to support countries in leveraging and scaling up digital transformation, and in aligning digital technologies investments with health needs while respecting the values of equity, solidarity, and human rights. And again, you youth have a great role to play within this. Right, so in doing this, these are some of the key principles that are guiding what we are doing within the European region. We're placing the individual at the center of trustworthy care that's delivered digitally, and we're seeking to understand the health system challenges, including the health needs and trends, and acknowledging the needs and expectations of the citizens and health workers. Again, there's that input from youth in what we're doing. And we're looking to recognize the need of policy decision-making based on data, evidence, and lessons learned, and allowing for continuous learning and adaptation. And in addition, leveraging digital transformation to reimagine the future of health systems. As I mentioned, it must become part and parcel of what we're doing in health. And to recognize, again, that institutionalization of digital health requires a long-term commitment and an integrated care approach. So it's not just we're going to buy computers tomorrow, we're going to buy software tomorrow. It needs to become institutionalized, long-term, and continuously developed, continuously monitored, continuously evaluated, and continuously improved upon. And again, youth are a key part of that. You guys are the connected generation, you are the digital generation, and you have a voice, and you have all of these innovative ideas, and you need to become a part of this transformation. So in setting the regional direction, we have 4 strategic priorities. And I hope I'm not boring you to death with all of this. So the 4 priorities are setting norms and developing evidence and informed technical guidance, enhancing the capacities at the country level, building networks and promoting dialogue and knowledge exchange, and conducting horizon scanning and landscape analysis. What does it mean for you guys? So that's a tiny slide. So I'm just going to read this out to you quickly. So in the first strategic priority, norms and technical guidance, we're looking to promote commitment and raising awareness of digital health. So this forum is one of these areas, for example, in which we're doing this. And we're conducting research and collecting available data, and we're using this to guide the development and adoption of digital technologies. So everything that we're doing is based on input and it's evidence-based. The second strategic priority is country support, and we're seeking to enhance and develop the national digital health strategies of the countries. And again, this is where youth, and this needs to be a multi-stakeholder approach, and youth need to be involved in the development of these digital health strategies. And we need to assess the country capacities for digital health and support the countries to strengthen these capacities. So looking at literacy and looking at digital health literacy, and ensuring that, for example, digital health literacy is part of the curricula. It's not just an add-on again. So when you go to school, when you go to university, medical school, digital health must be part of all of these things as part of your curricula. So moving forward, it is not something new. And the third priority is looking at networking and knowledge exchange and facilitating, for example, advocacy and promoting international multi-sectoral collaboration. Again, you guys have a role to play. And supporting dissemination and exchange of good practices and establishing platforms for dialogue. We're here sitting in this room, and I want to hear your voices. And the fourth priority is monitoring developments and trends in digital solutions and ensuring that a people-centered approach is considered in order to build trust and facilitate adoption of digital technologies. Again, we have to have a multi-stakeholder approach. Everyone from top to bottom, from the policymakers to the healthcare providers, to the users, to the end users, the patients, everyone needs to be involved. And we need to develop approaches to the management of health at the population level and facilitate implementation, evaluation, and the scale-up, as I mentioned. It must be a continuous process. So, going digital to improve the health of youth. And I will just get into the details. And in going through this, what I'm going to do, I'm going to go into the 4 areas that we spoke about. And we're thinking, what we want you guys to do is to start to think about these areas, and it's important to you as youth. So the first one is refugee and migrant health. And how is it that we can incorporate digital technologies into improving the health of refugee and migrant populations? As we all know, that's been a huge problem. It's been a huge challenge, especially now when you look at what's happening within this region with the war in Ukraine and the huge acceleration in people moving across borders and people migrating as a result of situations that are happening, emergency situations and so on. And how can digital health help in this? It can, for example, help in terms of access to health information and health services. It can help in prevention. For example, digital technologies can be used in health promotion and prevention. It can be used in patient care. For example, language can be a problem. Cultural challenges can be a problem, and using digital technologies, for example, in multilingual consultations, and using it to provide guidance to healthcare providers within a cultural context, and these sort of things, you can use digital technologies for those. And also disease surveillance and vaccination management, for example. We need to understand what's happening with the migrant populations, and using digital technologies, we can do that. And also, we need to consider the data and the security, because most migrant populations are vulnerable populations. And we need to have at the back of our head when we're implementing digital technologies, how can we keep this safe? How can we build trust in doing this? So key questions for this, and for you, and for our panelists, is how do we use digital technologies to improve access to services? How can we use digital technologies when we have language and cultural barriers? And how do we use digital technologies to build privacy, confidentiality, and build trust? And within using digital technologies, how do we ensure that, and not just for migrant and refugee health, but all areas, how do we not add to that digital divide? How many of you know what the digital divide is? Put your hands up. Okay, so for those of you who may not know, digital divide means that we're putting digital systems in place, but not everyone has access. And the more we try to push digital technology, those without access, they're being left behind. And we can't allow that to happen in all the digitalization we do. And also, in some cases, it may not even be prudent to put digital technologies in place, because it just wouldn't work. It's just not accessible. I'll give you an example of a study I was reading where there were an elderly population. They were doing a study, and in terms of their use of digital technology, for example, telehealth and telemedicine services. And it wasn't that this population were not digital savvy. They were. So that's another way that you got to think about it. These people were digital savvy. They just didn't want to use digital technology because they preferred to see a doctor face-to-face from that cultural aspect. So for them, that was still, in a way, building a divide because you didn't understand or you needed to understand the cultural context. Mental health. So I know this has been a big thing for everyone. I've seen all the work that's been going on to the mental health sessions and all the talks that we have, the very interesting ones from mental health. So what can digital technology do for mental health? In brief, for example, teleconsultations, telepsychiatry, telepsychology, and COVID has shown a rapid increase in that across the world, where digital technology has been used to reach vulnerable populations or people who've been locked in their homes because of COVID for months. How can you reach out? How can you have the support that you need? And using this is a way. Social media also. Of course, social media has its negative side as well as the positive side. So that is something that needs to be managed and used properly. And gamification. Mental health can be, good mental health can be tied to gaming. And I've actually heard from some people in this forum, in this room over in a few days, that they've been using games to cope. Because you can go online with your friends while you're locked in a room. You can go online with your friends, you can play games together, and it helps you to communicate, and it helps with your mental health. And of course, use of mental health applications and artificial intelligence. So there are applications, for example, AI applications where I can go on a platform and you can put in, you know, I'm feeling this way, I'm not sure what to do, and AI would help to guide you through questions or give you advice or even link you up to a hotline or something else, or a professional that that can help to further support you. So key questions for you are, what are the benefits of digital transformation for mental health? What are the barriers and concerns related to the use of digital technologies? And how can these barriers and challenges be overcome? Because mental health is, of course, such a complex issue, and it can have so many complex challenges. So inputting digital technology in place to support that, how can we ensure that it's done in a really good, sensitive manner that is useful, that is helpful? And sexual and reproductive health and rights. Again, how can we do this? And of course, as I mentioned, all of this, you will go into the breakout sessions, you will have more in-depth discussion and details on this to get your input. So in brief, how can we use digital health? For example, we can use it for knowledge and the use of apps for providers and patients. I'll give you an example. For example, in Denmark, there is a safe maternal app that midwives can use, and it can actually guide them through a process when they're helping a pregnant woman to give birth. And it goes through step by step. And it's adapted to be culturally sensitive and to be sensitive of the needs of the population and of the needs of the providers. So that's a good way where digital technology can be used. Another good way is surveillance and monitoring, for example, electronic medical records or other digital platforms of patient monitoring and continuity of care. For example, we can use it to monitor, we can use connected applications or connected devices to monitor a mother who's home and may be suffering from pre-eclampsia. For example, she's getting high blood pressure challenges. So a doctor can use a connected device to monitor these mothers who may be high risk. And of course, telehealth services. These are just a few examples. Key questions again, how does digitalization promote sexual and reproductive health and rights? What are barriers to adoption and use and culture and access, for example? And how can these challenges be overcome? One important aspect, of course, within sexual and reproductive health and rights that digitalization can be used for is to look at certain aspects, for example, such as gender-based violence. Of course, there's the other side of it, and for telehealth services and so on that we need to think of. How does a mother within a certain situation, how can we allow her to have access if the situation is sensitive in which she's in and she may not have access, or she may be in a situation where she's not allowed access to digital services? How can we deal with situations like that in implementing digital services? So these are some of the questions we need to think of on both sides of the coin. And of course, last of all, but not least of all, the next key stream is disability. How can disability be supported by digital technologies and digital health? How can digital health aid in inclusion? And some ways they're looking, for example, in applications, use of digital eye apps. There are now applications that can allow someone to, in a way, see what is around. There are applications that can be put on a cell phone in a way it's AI supported that someone can use to scan an area or scan a room or scan a page, and it will read it out to someone who is visually impaired. There are also applications in technology platforms, for example, text-to-speech. While we want to put digitalization in place, we have to be conscious of disabled persons. So for example, on your computers, if somebody is using their computer and they're hearing impaired, they're visually impaired, how can we make that more accessible to them? We may want to put digital technology in place. Fine, you can walk around with an EHR app on your cell phone. You can check your medical records. You can contact your physician. How do we ensure that those persons with disabilities can make good use of this technology? So that's another way that we need to look at it. And of course, there's other assistive technologies going into the realm of such things as robotics and so on. One example I was discussing the other day was, for example, a company called Hero Arm, where there are kids who don't have limbs or they may have lost limbs. And they've built these devices that it's like a replacement arm, almost like bionics, that someone can put on, especially for kids, and they have use of an arm. And what was so cool about it when I saw it was that they actually customized these arms. So for example, I saw one young person who got an arm, and they loved Marvel, and the arm was designed in such a way to look like Iron Man's arm with a repulsor and everything built into it. And so that's helping it inclusive technologies. And another example is AI-related hearing aids. Now there are hearing aids that are being developed that actually has artificial intelligence built into it so they can better try to have clarity in speech when people are talking to help people better hear, to clear up the speech and emphasize what is being said. So these are just some ways that digital technologies are important. So again, key questions. How can digitalization have a positive impact on disability? And what are the barriers to the adoption and use of digital technologies? And how can all of these challenges be overcome? Before I go, there's one other way. As a gamer, I like to play games. And one other example that I can use from a really interesting perspective was, for example, Microsoft and the Xbox adaptive gaming controller. And this was built specifically so that inclusion, there are many kids out there who can't play games and they would sit and watch their peers do it. Xbox developed a controller to enable them, and it's very adaptive, very modular, that you can design it in such a way you can use it to allow kids who are disabled to play games. And what was so interesting about it is even down to the packaging was developed with inclusion in mind. And that was, to me, it was an amazing thing when I saw them do it. So there are some ways that technology can be used. So that's me with all my talking. So thank you very much, and I hope I didn't bore you to death.
Thank you very much. Thank you very much, Ryan, for this first keynote. As you can see, we have a great panel here with several speakers that will give us the opportunity to now bring in different perspectives to dive deeper into the session. And we thought instead of us preparing questions to ask you, we would actually hand over the floor directly to you to have kind of a Q&A session with us also going in with additional questions if needed. But let's see what topics you prioritize. But to enable you to ask questions, of course, you get to know who's joining us. So let me briefly introduce to you our panel. I would like to start with Ben Otgen, who is a youth advocate and social media influencer, I believe on TikTok, but you can probably tell us more about that later. We also have Stuart Jordan, who is a digital developer at Moshiriki. That's a very difficult name for German. We also have Maria Sotiriou, external relations officer, do you say policy officer at WHO Regional Office for Europe. We also have Jack Kavanagh, who is an expert by experience, a health professional, and a motivational speaker. And we also have Catal Morgan, who is a technical officer at WHO Europe. And last but not least, we have Catalina Popoviciu, digital mental health researcher from Romania. That's a very brief introduction from my side with your positions, but we would also, yes, sure. But we would also like to ask you a brief question to give us a personal insight on who you are. And for that, I would like you to share with us what your social media bio says about you and one word that comes to your mind when you think of digital health. And then we will hand over to you. So let us start with Ben over there.
Hello, my name is Ben, as I just been introduced. So in terms of my Instagram bio, mental health advocate, signs, which is an interesting one. I'll talk more about it later, but it's the first campaign I ever did was I stood in streets with signs, and probably It's Okay to Talk, which is that campaign as well. And in terms of digitization, for me, obviously, that mental health, I think in a quick sentence, it would be trust. I think influencers and advocates can build that trust and community, which is very, very difficult to do. So yeah.
Thank you very much. Stuart, what's your perspective and what does digital health mean to you?
So my bio would be I help people create innovative digital solutions to problems and challenges in healthcare. For me, the most important word that comes to mind would be scale when I think about digital health and the opportunity to scale high quality services to meet currently unmet needs.
Thank you very much for sharing. Kathal, what says your bio about you? And I know that's been a difficult question.
A very difficult question. But just to say, my interest in work is in relation to digital and assistive technologies and about how we can make sure that all people of diverse abilities can be included in services and that the services are appropriate to meet people's needs. And for me, I'll have to give you two words, if that's okay. So life enhancing, that for me, it's about what we should be about is making sure that what we do is life enhancing.
Thank you very much for sharing. Catalina.
Hello, everyone. So I think my Instagram bio says that I'm a clinical psychologist and a PhD student, and I chose to add that because sometimes I share information about mental health on Instagram, and I like people to know that that perspective comes from a mental health practitioner. So yeah, and when I think about digital health, I think about creating a healthy relationship with technology and mainly with social media. Thank you.
Thank you for sharing. Jack, you're up next.
Yeah, so I'm going to give you two. I'm going to give you my LinkedIn and my Instagram because they're different audiences. So professionally, I'm a pharmacist. I'm director of the National Disability Authority in Ireland. And with specific interest for this panel, they have the Centre for Excellence in Universal Design. And I think that's really important for what we're going to talk about today. My Instagram handle would say that I love the outdoors and adventure sports, that I host a podcast called Only Human. And if I was going to name one word that I think represents my interpretation of digital health, particularly as a health professional, I think it is empowerment. And that's both from the standpoint of a professional and from a user.
Thank you for sharing. And last but not least, Maria.
Thank you very much. I just want to say that I feel really very happy to be here among brilliant experts and so motivated youth advocates on these important topics. So my Twitter bio actually says external relations with WHO. I'm also president of the LSE Alumni Association in Belgium, something that I'm doing on a volunteer capacity. And also one little achievement that I have, I got published by CERN and Springer Nature on an article. So yes, and Cosmopolite as well. So one word that comes to mind when I hear digital health, for me it's literacy, because I have seen how actually digital innovation and literacy can improve the lives of people, men and women, young and old. And next year, 2023, it will be the European Year of Digital Skills. So this is also something to bear in mind. Thank you.
Thank you very much. And just to also add, Ryan, your perspective to the panel, because you will also be feeding in. What says your bio about you?
Okay, so I have to check my bio. I can't remember what it says. So my bio on my Facebook says, digital health professional with a passion for public health, foodie, chef, gamer, and photographer.
And mental health, digital health, sorry, in one word.
And one word for digital health, I don't think I can give one word. That is so difficult. For me, for digital health, when I think about it, I think it can I think transformation, because digital health has the capacity to transform the entire health system, to make the health system more resilient, make it more responsive to the needs of the population, more timely in responding to the needs of the population, and at the end of the day, making health overall better for everyone and making our lives better. Thank you.
Thank you. So, as we unfortunately had to start the session a little later, we will prolong the session for 10 minutes. So we have about 50 minutes now for a Q&A. And I would like to encourage you, the participants, to take the floor, raise your hand if you would like to pose a question to the panel, and then we can jump directly into the discussion. If you already know who you would like to pose the question to, then please also let us know. Otherwise, we will try to direct it, or the panel can indicate. So who has a question for our distinguished panel?
Hello. So my question, well, it's mainly towards Jack, but honestly, I think almost everyone is, not everyone, but so basically, we talk a lot about disability, and nowadays social media is getting up on it, which is very good, obviously. But then all the people that are not targeted on social media, so all the disabled people that are invisible because they don't have internet, because they don't have access to all those resources, are still invisible and are still in situations where they do not have any kind of support or sense of community or access to any of these services. So how can the digital world and also the new improvements and new technologies actually reach out to those people that are not as easy to get to through internet? So basically the very direct connection of providing reasonable and accessible resources and technological resources to the people who normally do not have access to it.
Love that. Thank you very much. So I think before I answer, Carl will have interesting things to say on this as well from a service provision perspective. I have a before and an after in my life. So up until the age of 20, I was up on my feet and strolling around the place. And then I had a spinal injury when I turned 20. I had a very simple accident on a beach and I broke my neck. And so very much two experiences in life. And so I have perspective to a certain extent on two ways of navigating the world. And what was startling to me is I was in my journey of becoming a health professional during that time. And I come from a middle class background, upper middle class background, and so there's inherent privilege in that. And the more I got exposed to people with diversity of ability in all different walks of life, regardless of whether it's a spinal injury or someone living with autism or someone born with cerebral palsy or whatever it might be, is that very often alongside that is lower access to education, higher burdens in terms of costs associated with living. So poverty becomes a challenge, and all of these things add up and disempower and ultimately disable an individual. Okay, so that's first thing to state. Technology has a massive role to play for all of these individuals. Access is the challenge, all right? Not all technology is cheap, but it can be a game changer in empowering someone. I would always say that the environment is the thing that enables or disables anyone. That is the physical environment, the cultural environment, legal policy, and importantly, the environment in between our own two ears. But when we think about things that can be real empowering solutions, can be, to use your word, transformative, is very simple assistive technologies. And we see that across the board. Simple ones that were mentioned, which I have seen used, are applications on your phone, if you're vision impaired in some way, to use your phone as a magnifier, and to use your phone to read things back to you, things that we all use day to day, voice notes on WhatsApp, speech-to-text recognition, which I love. These kinds of things are very simple examples of it. But there are many other iterations of this. Smartphones have kind of democratized access to basic assistive technologies, I suppose, which are hugely empowering for a lot of people. But other ways to think about assistive technologies are very practical things that aren't necessarily considered digital, but wheelchairs. These are very simple things. So I've gone on for a little bit. Digital technologies fundamentally can transform people's lives regardless of the extent to which they are differently abled. And importantly, and I think Cathal would answer this section a little bit more, they can give access to services that otherwise are completely inaccessible. And just to your point, we're seeing an increasing community of people in online spaces, be it Instagram, Facebook groups, these kind of places where we're seeing role modeling, we're seeing communities developing, we're seeing peer support, and dissemination of information, which is really important. It's usually local, reasonably local, yeah, I'll leave it off there.
Thanks, Jack.
A short addition, please.
Yeah, so very quickly, first of all, your observations are spot on. The evidence concurs with what you're saying. Anytime we work with a country, awareness of digital and assistive technology and the resources to have access are the two biggest barriers that people face. Two more points just very quickly, if that's okay. It's important, I think, to get across the message that to change that fundamentally does require something of what was said earlier, which is advocacy. And from that standpoint, it isn't about just equality and access. It's also, it makes economic sense. I mean, there's a very clear study that was done by a global partnership called AT-Scale, which is about assistive technology, which basically says that for every $1 investment, there was a $9 return to the economy. Because people can access labor, can access education, can live, work and play and have relationships. So it actually makes sense on all those fronts. Final thing I would say, just from a health professional point of view, is if it's okay, we need to recognize also that digital and assistive technology on its own may be limiting. We need to have services that go with them. So people can also benefit from various forms of rehabilitation, like speech and language therapy, access to psychology, et cetera, et cetera. So we shouldn't see it as being a linear thing where if we have this, then everything will be okay. We do need services too. So that's just to say that point. Thank you.
Thank you for bringing in your perspectives. I'm very sorry to be so harsh on the time, but I would just briefly mention that you, for instance, will be hosting a breakout session afterwards, diving deeper into the topic. So yes, let's go on with the next question.
I'm going to present a little bit of my own story. I'm Pete. So as a gay person, as a person with ADHD, and recently unemployed, I really had a huge struggle with mental health. With having first time in my life panic attacks, not being able to reach a mental health provider, as I'm from Cyprus, but I live in Belgium. So the economical factor was a huge struggle. But well, I'm not going to direct the question so much, but you can feel free to give a little bit of a help here. On one side, I'm very happy that now I can have a mental health provider online in my own language back home and have this service in a cheaper price, let's say, with the digital payments, etc. But on the other side, thinking about monkeypox, I'm afraid as well to share a lot of my data because I might live in Belgium, but the change of mentality towards LGBT community in Belgium, which can be very shocking, also makes me fear like, because they were asking, based on the number of STDs you had in the last year, you're eligible or not towards vaccination. And I was like, at one side, I need to care about my mental health and the access on that part. So digital is quite important. But on the other side, why would I need to expose myself if I had or not STDs, which can fit into the stereotypes about sexual life of men, etc., to be able to be healthy or to be able to socialize as a gay man within my community. So what's your reaction when it comes to that? Like, I'm very happy that we have services and technology indeed, in most cases, becomes more inclusive. But on the other side, how can I make sure that this inclusive technology doesn't become an enemy of me and my life? Thank you.
So who would like to take the question on the panel? Yes, go ahead, please.
So when it comes to using people's data within these kind of interventions, I think we have to be very careful with what systems we're using and how those systems have been designed, respecting privacy and being very clear up front about what that data, why that data is being collected in the first place and what uses it may be able to be put towards. And gaining consent for that in a very clear and understandable way is, I think, a vital step in the development of any digital health service. I don't know if that answers your question a little bit. It's a challenging area that's certainly evolving a lot at the moment.
I will take one more comment, but please keep it short.
Yes, it will be short. So regarding protection, health data are the most sensitive data. And nowadays, the European Union, the European Commission, has started a new legislation piece on having a European health data space. This is a revolutionary health data space. It's a pioneering thing. But when it comes to protection of data, within the EU, we do have the GDPR. So the idea is that your data will be duly protected and will not be shared. So I hope this answers your questions. And maybe very briefly again on mental health. You know that we do have within WHO Europe the Mental Health Coalition launched by our regional director, Dr. Hans Kluge. And in the wake of this initiative, also the European Commission is now having mental health as an initiative in the 2023 policy program.
Thank you very much for your perspectives on that. I see one more question over there. Could you pass the mic? Thank you.
I have a question for the whole panel. What is your experience and knowledge in regard to set up digital mental health services in countries underfunded, like Albania, for example? And so what would be some of your suggestions or experiences for health professionals, like such as me, in order to help set up affordable and digital health services for people in need? Thank you.
Thank you. I believe that's a challenging question for the panel, but I would go into the direction of WHO maybe.
Oh, that's a tough one. I think one of the things that can be done is looking towards what mental health services or communities exist within your country and coming together and having these discussions with those organizations or those units or those services. And one of the big things that you can do is to do advocacy. You can do your research, and you can even contact different, there are existing organizations, or you can go online and you can find information about existing services, existing digital services that may fit the purpose. There are, and you can even, not necessarily in Albania, but I mean outside of Albania, and you can adapt it. But one of the big things is, and again, it comes to lessons learned. You can say that, you know what, we have done as a collective group, we have done this research, and we've seen these things that are working, and we're advocating for support to develop these technologies within the countries. And there's a lot of data out there, for example, in terms of telepsychiatry services, what the numbers are there to show the transformation. And you can use the evidence for advocacy purposes. For me, that's the simplest way of going about doing it. Advocacy and having a voice is an important part. Of course, I know it's way more complicated than that, but as a start, that would be my basic advice.
Again, that panel is definitely diverse in its perspective, but not covering all perspectives. But I think that's a perfect opportunity here to have so many diverse people. And it's good that you raised the question, and maybe somebody in the room also has an answer to that. So feel free to reach out and to network. Because of time, and I think that's very, very unfortunate. I already have to conclude this panel, but don't worry, as we said, this is just the opening for the breakout rooms, and you will find most of the panelists in the breakout rooms in their expertise areas, so you can dive deeper into the topics. But I would like to conclude, because also not everybody on the panel had the chance to speak, which is even more unfortunate, to have a conclusion round. So I would like to start with you, Ben, with something you would like to raise at the end of this panel to make people aware of from your perspective.
Thank you very much. I think, once again, it's going to what I said before. I think there's a lot that can be done in terms of online communities and trust between people online. And I think influencers and people like that are really, they can pave the way for showing, everyone else how to do it, because they have that connection with that person, right? And I think that's something that we can learn from, and we can definitely, put something into place or do it more. Or, I think that's one key area that I think we really need to kind of target.
Thank you very much. And Catalina, what would you like to raise in conclusion of this panel?
Yeah, thank you. First of all, I want to say that I think it's really important to focus on collaboration, collaboration between tech companies, between policymakers, between users, if we are talking about social media, between clinical psychologists, and between community, in order to increase awareness about the negative aspects of technology, and also to increase, in a way, the benefits of using technology. And yeah, I'm really excited to hearing all your perspectives on our breakout session, and to learn from you, and maybe to understand better how can we create a healthy space in social media. And I'm talking more about social media because this is my expertise, and my research is mainly focused on social media use, mental health. So yeah, thank you.
Thank you very much. And one final concluding sentence from the rest of the panel. So Stuart, what issue would you like to raise?
I'll just answer the last question. That I helped the World Health Organization develop a scalable intervention for adolescent mental health. So I'll talk to you after. That's all I'll say.
Perfect. Then, Kapil, from your perspective.
Thank you. Very quickly, and I'm just struck by the question that was posed. I mean, the first thing you need to realize, you're not going to be able to boil an ocean overnight. Start small and work from there. There are a lot of training institutions here today, and students of medicine and other health and social care professions. Why not? Because it has to be introduced into the workforce. Start small, introduce it into your programs, build capacity in the health professionals that you're training today, who will be the leaders for tomorrow.
Thank you very much. And Jack, what are your final thoughts?
Some of the things that struck me as we were discussing was that it's always talked about innovation in digital health, and there's a sense that in order to start something, we have to build it. Not always. There's incredible technology already out there, so much that we can use that's already plug and play. Very often, all that needs to be done is to implement what's already there and relatively cheaply available. You don't have to reinvent the wheel if you want to use digital technology. Often the simplest solution is the most effective in that realm, as with in many others.
Thank you very much. Maria.
I would say be early adopters. You don't have to wait to be sick. You can already help. You can help actually health professionals by reverse mentoring. Be digital ambassadors for elderly, for people that are less literate than you. And I think for our continent, we can do a lot of things when it comes to the health innovation space. It's actually what Mahatma Gandhi encouraged us to think. Be the change you want to see in the world, right?
And final concluding thought from you, Ryan.
Okay, so final concluding thoughts quickly, and I will add to what Ben said. One of the things that indeed is very important, it's not about the technology. The technology is there. It's about the systems that we put in place to use that technology effectively. A lot of technology is there. We need to ensure that the policies are in there, that the funding is there, the human resources, you guys, are in there, and all those other underlying building blocks for digital transformation. We need to ensure that those are in place, and they're in place sustainably and monitored. And secondly, you as the up-and-coming generation who are becoming involved in this, you're the ones who need to drive this forward. You're the ones who need to become leaders. You need to be involved in research and get those numbers out so that you can go to the leaders and say, you know what? The research is showing this. We are asking that you put this in place. You guys need to be the driving force and the innovators behind this, because at the end of the day, you're the upcoming generation and you're the ones who are going to be using this and sustaining this in the future. Thank you.
Thank you very much. And for us, the young people, to take up that responsibility, we need the spaces to discuss and to dive deeper into these issues. And that's exactly what will take place now after the session in the breakout rooms. You will have the experts there to listen to you, to also feed into your perspectives, and then, of course, much space for you to discuss in, I think, more than 1 hour in the respective topics. So I would like to thank you, the panelists, for joining us, and also thank you for leading this panel discussion with your questions, and enjoy the breakout rooms.